Good afternoon. Welcome to day 214 of the St. Clair County EMA briefing, where Chairman Mark Kern and Sam Behrman join us again today. Sam, you have the numbers.
We do. Some numbers that we are not too excited about bringing to you guys, but they are numbers that we bring to you every day. So as of today, 100,677 St. Clair County residents have been tested, which is an increase of 815 from yesterday. We are at 8,147 positive test results, which is an increase of 42 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 5.2%. We are at 92,530 negative test results. And unfortunately, we are announcing 4 new deaths today, which does bring our total for St. Clair County up to 205. There was a female in her 60s and a female in her 80s with unknown health conditions. And then we had 2 males in their 80s also with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 7,458. For state totals, 6,411,254 have been tested. We have 324,743 positive test results, which is an increase of 2,851 from yesterday. And for deaths, the state is reporting 9,026, which is an increase of 29 from yesterday. For hospitalization numbers that are in St. Clair County, currently we have 41 individuals that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 87 patients that are admitted due to COVID-related reasons, and 7 of those individuals are on ventilators. For our congregate living facilities that are in outbreak status, we will only announce any facilities that have had any changes. The first, the Esquilin Dammert Center at the Shrine, has 45 cases and 4 deaths, which is an increase of 1 case. And Integrity Healthcare of Smithton has 60 cases and 8 deaths, which is an increase of 1 case and 1 death for that facility. We still do have some testing available this week. Thursday, October 15th at Chevy Park. It's the Ag Building in Mascoutah from 10 a.m. to 12 p.m. and from 1 p.m. to 3 p.m. And then Friday, October 16th in O'Fallon, we have the new St. Clair Church from 8 a.m. to 4 p.m. And if you are needing to see any of that information again, it is posted on both the St. Clair County Health Department Facebook page as well as the EMA Facebook page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. These are the changes in these particular St. Clair County zip codes today. In 62203, we went up 1 to 235. 62204 also goes up 1 to 163. 62206 goes up 3 to 505. 62208 goes up 2 to 479. 62220 goes up 11 to 641. 62221 goes up 3 to 754. 62223 goes up 3 to 502. 62226 goes up 3 to 848. 62232 goes up 2 to 211. 62258 goes up 1 today to 207. 62260 goes up 1 to 163. And 62269 goes up 4 to 646. As you heard Sam say, our daily county positivity today is 5.2%. That takes our 7-day rolling average to 5.6%. So St. Clair County continues to do pretty good, although we could do better. Regional positivity, these are the state's numbers. As of today, we're up again to 6.6%, something that we don't like to see the up because we've got to stay under 8. So let's keep doing what we're doing, Team St. Clair. Of course, those numbers are derived from all of the counties that are in our region. Today, Bond County clocks in at 15.6%, Clinton at 6.3%, Madison at 7.8%. Monroe, 3.8%. Good job, Monroe. Randolph County is 8.2%. St. Clair comes in at 4.3%, and Washington County is at 3%. So Herb, we're watching those regional numbers. Even though we're well below 8 still, if we keep going like we're going, it won't be long till we're back where we were.
Yeah, that's we're watching the other counties, and I'm happy to see that some of them are really stepping up with more testing, and that's really helping out. But we went up again today on that positivity rate up to 6.6. And as you said, as we are slowly creeping back up, it's not going to take that long to get to that 8. And then once we do, if we do, and if it's there for 3 days, then as I said the other day, then there's going to be a lot of unhappy people again, us being a lot of them, because everybody has worked so hard, Team St. Clair, and I don't know what else to say other than the fact that we need to keep spreading the word, washing the hands, wearing the mask, watch the social distancing, the physical distancing, and if we all do that, we should be able to keep those numbers down, but it's obvious that we are creeping back up there.
I guess if there is a bright spot, we had a huge amount of deaths today, just terrible. But the hospitalizations have not been this low since the middle of last month. So about a month ago, we've been well above this number for most of that period. So to be back where we were back in the middle of September, I think is a good sign, something that we can hold on to.
Well, the concern we've been talking about for the last week or so is with the winter months coming on us, fall here, what impact is the flu season going to have? I know flu shots are being offered now, so please remember to get that. Some of the studies that we've been looking at and reviewing, if everybody wears their mask like we're being asked to do, maybe that will cut down on the flu season. So maybe that will take it a lot easier on our hospitals. And, again, we still see the naysayers out there that don't want to wear the mask. And, we try to bring you all that information. As the chairman said, 4 more deaths in our county, up to 205. One is too many. If that doesn't send the message home, I don't know what does. I responded to a message on the page last night where, people were talking about, well, people die from the flu. Well, we all die from something, but, there's vaccinations for the flu. There is nothing now, as you've heard us say before, for the COVID right now. It's like when people were saying the long-term health care, people were in there that had this, and doesn't mean because you go there you have to die. So if we just do our part to be part of the solution, and it's real simple. I see young kids out wearing masks, but then I see some adults that think they're invincible. They don't have to. And as sure as I'm sitting here today, you people that are out there that don't think a mask is going to be a defense for you, I guarantee you, if something would happen and you would come down with this virus and you would end up in the hospital, and God forbid you'd end up dying, it will be your family or your loved ones that say, oh, why didn't he wear a mask? I mean, everybody's telling you to. It's a decision you make, and I'm telling you, it's not the right decision until you bring me the medical experts that have been here on this program and said that it's your best defense. If you bring me somebody that will tell us that we don't have to wear a mask, then I may think otherwise. But right now, every physician that we've had on here, the same physicians that tell us when we go to the hospital, when we've got other issues, when they say take this type of medicine, you run to the drugstore and get the medicine. But when they tell you to wear a mask, you act like, oh, they don't know what they're talking about. Well, we here at Team St. Clair are going to believe what our local physicians are telling us to try to stop the spread of this deadly virus. 205 of our county residents don't have that decision to make anymore. So think about that tonight. 205 St. Clair County residents that aren't with us anymore. We'll be back with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow with some numbers for you. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and